This panel is, in a way, going to dig a little deeper in some of the topics that we already talked about. It's called the panel on readiness, and basically I think the concept is that people are coming to this topic from very different spots and different places, and there was some feeling that we needed to think about what it is that you need to have to be ready to jump into this. My name is Lester Solomon. Can't hear? I am a former Deputy Associate Director of OMB, and I think one of my biggest takeaways from this session already is that OMB is a different place than it was when I was there. We were the Department of No, and I guess somebody else is performing that role in this town these days, and so OMB has been free to spread its wings and begin to innovate, and it's wonderful to experience. So I'm delighted. I'm currently the director of a research center at Johns Hopkins University focusing on the nonprofit sector, trying to put this sector on the economic map of the world. So we're working in 40 or 45 countries. And I think what brought me to this position today is that I'm also working on a fairly sizable book on what I'm calling the new frontiers of philanthropy, looking at the new actors and the new tools, including social impact bonds, that are emerging powerfully, I think, in the broad world of philanthropy and social investing. And so this is a delightful opportunity for me to hear about, on the ground, one of the more important innovations that's going on. Let me introduce the panelists. I think you've already heard about the great Jeffrey Liebman, who I've just met and I'm delighted to meet. Jeff is a professor of public policy at the Kennedy School and works on issues related to tax and budget policy, social insurance, and he has come out of a spell at OMB working on some of these same topics. The second person is George Overholzer, whom I have known for quite a while. Delighted to see. George has one of those incredible titles that I think we all sort of would die for. He is the Entrepreneur in Residence at New Profit. What a wonderful, wonderful title. But has a really stellar background as he's now the co-founder of something called Third Sector Capital Partners, which is working precisely on social impact bonds. But he has a long history of involvement with the Nonprofit Finance Fund. He was the managing director of NFF Capital Partners for a number of years, and then has experience in the banking world at Capital One Bank. Tracy Palangian, I hope I'm doing justice to your name, is a co-founder of Social Finance Inc. in its U.S. manifestation, which is an entity also that is working directly on social impact bonds. She was managing director at the Parthenon Group, which is a global strategy consulting firm for 11 years, and there did a substantial amount of work on nonprofit issues. She has had a stint at McKinsey & Company, which seems to be a requirement for anybody entering this field, and so comes also with a background coming, she was born in Hong Kong, and so she can speak to us both in Cantonese and Mandarin. If things get tough, you can just switch to that. So ni hao. And then the fourth person is Bill Pinikevich. Did I do okay with that?
Very well done.
Thank you. Bill is working also with the Nonprofit Finance Fund, working on their programs in New England, but is also working on an assessment that NFF is doing of this whole idea of social impact bonds. He has 20 years of experience at Citigroup, and so brings also a deep understanding of finance. So we're going to use the same rules as Doug articulated. We've got a series of questions. I'd like to try to cover 10 topics in our now 55 minutes or 50 minutes. And so we'll have to move quickly. Some of them are topics that we've already touched on, and so what we're going to try to do is dig a little bit deeper into these topics and pull out the experience that all of you have had in some of them. The first topic is the selection of fields. You know, how do we go about choosing the fields? Which fields are appropriate for this particular tool? And I'd like to hear the names of the fields, but I'd like really to dig a little deeper and try to understand what are the characteristics of the fields. What makes a field appropriate for this tool? I think we heard a couple of these characteristics. It's good to use a preventative, an area that is a preventative program, something that is going to deliver results in a reasonable period of time. But Jeff, I wonder if you could get us started on what your experience has been with the fields that seem most appropriate, and if you could articulate what you consider to be some of the characteristics that make a good, appropriate field.
Great, thank you. My experience has been that when one sits down with experts in state budget offices or policy advisors to governors or mayors, it's pretty easy to come up with a list of a dozen or 2 dozen policy areas where we're underinvesting in prevention, or otherwise making penny-wise but pound-foolish budgeting decisions, to come up with ideas where we're come up with policy areas where we're the current ways that we're spending our money leaves us very uncertain about what results we're getting for it, or to come up with areas where we know there are innovative new practices out there but we haven't adopted them or funded them. So the challenge, I think, isn't so much coming up with a lot of areas that could benefit from a new funding approach. It's really narrowing those down to ones where the pay-for-success technique is likely to succeed. And I guess I think there are 3 criteria that are the most important ones in identifying the places that are at least where one should put one's initial energy. One is that the policy area just has to be a top priority of the governor or the mayor to be worth doing, and you have to have strong agency leadership, because it takes a year to 18 months of a sustained process to put one of these together, and if it's not at the very top of the priority list, it's just not going to happen. And so I think that's sort of the number one criteria. The second criteria is there has to be sufficient rigorous evidence that the intervention's likely to succeed. If you're going to pull together a lot of folks around a performance-based contract, people aren't going to want to be part of that deal unless they think there's a 2/3, 3/4 pretty good chance it's gonna succeed. You can't go for the 1 in 10 shots with this kind of mechanism, and so I think having strong evidence is a second criteria. Even if there's just a wonderful program you'd love to try, you think it might work, it's probably not a good fit if there isn't pretty good reason to think it's going to succeed. And the third criteria I would say is one has to have some vision for how a particular pay-for-success contract is going to lead to something bigger. Whether if you pilot something and it works, you can roll it out to the whole population in the state or the city that's getting this kind of service, or some way in which by showing a performance-based way of paying in a particular area of the budget, you can reform how that area of the budget is being done more broadly. But again, just these things are hard to do, and unless you have some big impact in mind, it's probably not worth it. And so I would say those are the 3 criteria. And I think if you think about the particular policy areas that came up in the first panel, I think almost all of those examples, probably all of them, meet these criteria. They were at the top of the policy agenda for the mayor or for the governor. You can see why they would have a very big impact, for example, on the crime situation in an area, or on healthcare costs. You can see that they fit into areas where the existing budget probably doesn't have the right institutions. And so I think they all came out of areas where people could see this bigger vision for where it was going to go if it succeeded.
Could you say a word, if I could follow up, about the time dimension in the measurement and likelihood of success? I mean, you didn't mention that. Is that implicit in your emphasis on likely success? Is it likely success within, let's say, the period of time that a particular elected official is in office?
Yeah, I think none of these are actually, I mean, some folks may have, it's very unlikely that any one of these contracts is going to be concluded within a particular term of any elected official. If you sort of imagine giving services for 2 years, measuring outcomes for a couple of years, you're on a 4 or 5 year time frame. And so some people get nervous about that, but then I tell them if it fails, you're not going to be on the hook either. So I'm not sure which way it cuts in terms of making this a more promising initiative. But I do think the points that were made on the earlier panel, the direct attempt to monetize savings isn't going to work for something where you're trying to serve 3-year-olds and wait and see whether they graduate from college and have earnings. And so I think there is a time dimension to all of this.
Tracy, I wondered if you could come in on this topic as well, that is the choice of the area. You were involved to some extent in the experiment in the UK. How did that one get chosen, and does it fit the criteria that Jeff just laid out for us?
Absolutely. What Jeff said about the subject matter, the application matter being a high priority of the government is absolutely critical. And Jack Straw, who was the previous Minister of Justice prior to Ken Clark, who signed the deal with our sister UK organization to launch Peterborough, which is a short-term stay prison 45 minutes out of London, was very much, criminal justice is very much high on their policy agenda. So that was chosen because there's great championship politically to get this very complex arrangement to execute. The other areas and the other kind of principles driving different policy areas to experiment with this pay-for-success arrangement, I think are threefold. The first one, which I think was mentioned in the previous panel, which is that positive social outcomes can generate, or we have a high degree of comfort that positive social outcomes can generate net savings to government within a reasonable time horizon. Now, there are many different words buried in the statement. One is net savings. The other is positive social outcomes leading to such, which then underlies the importance of prevention. And then the third element of that statement is around the time horizon piece. And I think it's critical because earlier there was a healthy debate between Robert and Jay around different kinds of whether early ed is too long, is homelessness and supportive housing, is that quote unquote a reasonable time horizon? I think it's important to tease out different types of pay-for-success arrangements. The Peterborough issuance is actually a social impact bond or a pay-for-success bond, which is actually drawing third-party capital to fund the upfront services around prevention, and then government pays at the back end upon hitting certain results. Now, there are also pay-for-success contracts, which I think Robert was alluding to, which is more about having more evidence-based, outcomes-driven government contracting. In that sense, there's actually using existing government resources more efficiently and procuring for programs that are much more evidence-based. And because a pay-for-success bond or a pay-for-success a social impact bond is leveraging a new source of capital, and these are investors looking for a return on their money, the idea that you have to generate net savings to fund that return is actually critical. So what we're trying to do is find arrangements or policy areas where investing today in prevention would yield savings tomorrow in terms of avoided costs or more expensive safety net remediation, crisis response types of spending down the road. And because it's that monetization of that difference between prevention and safety net services that provides the fuel for this financial engine to repay the investors. So net savings is, I think, critical, and net savings also means that there is net savings, as I said, accrued to the bottom line of government even after they repay the investors. And that's also a critical point, that the programs that we're funding upfront through this arrangement cost less than what ultimately would be paid by government in the absence of these programs. So the first one is around the potential for net savings. The second bucket of criteria is around finding, and I think Jeff articulated very well, articulating proven innovations that have demonstrated that they can have evidence. And the second part of that statement is also finding nonprofits or providers who have demonstrated a track record of achieving such. We can talk about the level of evidence later on, and I think you plan to do that, Lester. But I think it's very important to know that the social impact bond arrangement, the pay-for-success arrangement, is to scale what has proven to work. It's not about funding unproven programs. What's unproven here is the financing mechanism, not the model of intervention, because there are inherent in this process are a lot of risks. Political risk, model risk, execution risk, and not least, the financing mechanism some risk. And then the third bucket, which I think the earlier session that Jatinder spoke so beautifully about, was around measurability, and the earlier panel said that too. What are the conditions for robust measurability? How do we define the target population? How do we actually articulate these social metrics, which are actually not easy to articulate? Someone earlier in the morning panel drew the analogy about infrastructure financing and energy savings financing. In those instances, there's actually a meter in the building, and you can unambiguously say whether you have achieved outcomes or not achieved outcomes. In the social services arena around human services, it's actually very hard to articulate these outcomes, but I think the field has come a long way, and there's a lot of promise around integrated data systems, around different evaluation approaches to arrive at that measurability piece. So it's those three conditions that very similar in the U.S., but obviously our U.K. colleagues use those lenses to pick criminal justice as the first area to experiment. And by far, I think it was very clear in the earlier panel that this is not a panacea. Not everything is going to work. And I think we should be realistic to think about what are the right application areas to test the first phase of this arrangement.
If I can just follow up with one thought, what this means is that it's really only going to work in countries that have pretty well-developed social safety net programs. If you don't have those programs in place, you don't have any savings. And so it, in a way, has this kind of ironic consequence that it only works in the places with substantial safety net programs.
Well,
and in fields where those programs are already in place.
Absolutely. I mean, I come from, as Lester mentioned, a different part of the world. I grew up in Hong Kong, spent a lot of time in Singapore. In fact, in a country like Singapore, where there's actually little government inefficiencies to be driven out, because it's that savings that's providing the fuel to this engine. Again, talking about the social impact bond, not pay-for-success contracting. You're absolutely right. You've got to drive out inefficiencies in order to achieve savings.
Okay, we'll come back to that, I'm sure. I want to turn to George. This town has seen a lot of great ideas roll through it. Management by objectives, zero-based budgeting. How do we know that this is not one of those? I mean, has it got staying power? Is it a fad? What is the evidence? What is it that's driving so much of this interest, and is it likely to be one of those ideas that really stays and grabs hold? And how do we know?
The latest flash in the pan. I'm recalling, this must have been 5 or 6 years ago, I gave a talk about this type of an approach, and there happened to be a U.S. senator sitting next to me. And at the end of my talk, he's a nice guy. I knew him a little bit from previously, so he was kind enough to whisper something in my ear after the talk. And he just came over. He said, "Don't even try. It'll never work." Thank you very much, Senator. He had wrestled with budgets for a long time, and he also came from a similar background that I did in the venture capital world. And he said, be careful not to apply the private world concepts to the government. It's an entirely different creature. And so what is different about this is a very, very valid question. Are we just fooling ourselves? And what someone once said about innovation, there's always something new under the sun, right? And you could say, aren't we trying to do something that already exists, which is the public financing approach for, let's say, transportation or energy savings? And if it hadn't happened already, why would it happen now? Very valid question. And I guess there are two pieces to the answer that we've already touched on today. The first one is necessity is the mother of invention, or never waste a crisis. I think that we've heard several times already this morning from public officials that there's no choice now to try something new because of the tremendous pressures that we have. And I think that's definitely the case. But I think the more profound thing that's going on, the big revolution that I see that's different, is in the world of capturing data that can reliably indicate whether or not programs are being successful, and reliable enough that people are actually willing to build contracts around them. And if I could just step back a little bit to share some of that thinking. How many people here have seen the movie Moneyball or read the book Moneyball? So it's an entertaining book and an entertaining movie. I also think it's a profound trend that's happening. It's part of the information revolution, which is that more and more in business 15 years ago and in government today, we are capturing information as a byproduct of running programs, running the businesses. And for many, many years, the words random controlled trials will send shivers down the spines. We heard Doug earlier incredulously saying, "You're not going to ask us to do random controlled trials, please." Why? Because it has been historically extraordinarily difficult to actually find out what works and what doesn't work. So difficult that in order to get the answer to that question, you had to subject yourself to the outrageous slings and arrows of what can be $1 million exercise in many cases out there, fielding surveys, subjecting people to randomization, depriving people of services in some cases, in the name of finding out whether it works. There are many ethical issues. There are many operational issues. If you are running a program, to have it frozen while you're trying to undergo a random control trial is very difficult, let alone trying to raise the money to do it. And so as a country, I think we have largely flown blind because we don't do enough random control trials. But on the other hand, if we tried to do random control trials for everything, we might grind to a halt too. So the new thing under the sun is something akin to Freakonomics. It's that administrative data that's more and more ubiquitous. It can now, at a much, much lower cost, provide the insights into what's working and what isn't working in the same, in a random control type of a way. And we are learning now that we have this information, we're learning to build contracts around it. So I guess that would be the main answer.
Okay. Of course, there's a lot of pushback all the time on generating that administrative data. So how do we convince state and local governments, for example, to begin to collect more data or effective data? We certainly know in, for example, the social service block grant program that we don't even know what the money's spent for, let alone whether it's effective. And that's not a product of a decision at the federal level so much as it is a pushback at the local level.
I think that's right. I think this is something that's taking place in nooks and crannies, and you can never predict exactly where the next kind of newly abundant data is going to be. I was visiting a Secretary of Education yesterday, and I asked him, what's changed the most in what you do? And he said, it's the abundance of data. I am seeing now actuarial reports that give very reliable statistics across each of my schools using the same methodology in all these schools to measure gains, and with very good adjustments having to do with what types of kids are in one school versus another school, so that people trust the data. Now, it may be that in other areas
Maybe
that hasn't
No Child
happened
Left
yet.
Behind, it's forcing that. Bill, you've been very patient.
Really? Okay, good.
So I'd like to turn the focus now onto the service providers, the people that are out doing the work that is going to yield the social gains that's going to in turn produce the savings. What's their perspective on all of this? Why would they jump into it? What's exciting about it to them? And what are their concerns? Because essentially this is shifting risk. They're going to absorb more risk. What's in it for them, and what's their perspective on all of this?
Good question. Let me kind of frame that somewhat by talking a little bit about what we've learned working with service providers and the innovative ones who are doing really good work. An innovative service provider is very adept at building an organization that is acknowledged to be making meaningful improvements in the lives of individuals, families, and communities that they serve. Very, very simply. And it seems like that's kind of trite, but the ability to deliver positive outcomes is really the kind of signature item of a really good service provider, okay? So that's first and foremost. Second, we learn also in all the work we do with the providers that they are constantly looking for resources, and capital is very important among those resources to build capacity that will enable them to, on a continuous basis, refine their business models, and refine their program models to enhance and expand their ability to bring meaningful improvements to the lives of individuals, families, and communities. And that's the context in which to understand kind of the perspective that service providers bring to this whole notion of the pay for success model. And I'll talk about their excitement about this a little bit for starters. Let's start on the positive side with it. And let's start conceptually with that. Okay, in terms of the model as a whole before breaking it down into its pieces. And conceptually, they look at the public or the pay for success model as a potential vehicle that has a very high potential as a means to that end to deliver increasingly meaningful improvements to the lives of individuals, families, and communities. That's first and foremost what's there. The second piece of it is like really an important thing to emphasize, and that's that for the first time in the pay for success model, there is this very simple and very powerful algorithm that's been very elusive in the social sector, and it's a really simple, straightforward algorithm. Positive social outcomes, meaningful improvements in the lives of individuals, families, and communities equals economic value. Okay? And that economic value can be measured in a return on investment. That economic value can be held in your hand in dollars in terms of savings and spent, just like the economic value of an iPhone, a car, and really good software, okay? And that's an incredible statement from the perspective of the excitement that this model brings to service providers because it validates what it is that they are doing on a day-to-day basis. The social good has economic value, and that's generating a bit of excitement. And you think about this, in this model, what ends up happening is that private capital comes to bear and is invested in a national infrastructure called the social sector and social services, and that produces economic value to governments and to investors. It's a wonderful concept, very powerful. Never existed before that transaction occurred in the UK, where the monetization of social impact was the real breakthrough in the thinking and the brilliance of this whole concept. Okay? So that's the second piece of what the concept that is attractive to the service providers are. The third piece is that their excitement is neither limited, and they have reservations about it. Okay? And let's talk about some of that. I can kind of break down kind of the essential calculus for you of the pay for a success model, and let's look at each of those pieces and like talk about that tension a little bit. We're excited about it, but our excitement is limited and we have some reservations. So when you look at the calculus of the pay for success model, there are really three things that all of us kind of think are essential that are incorporated into it. The first piece of it's been mentioned 1,000 times, which is private investors bring a new source of supplemental capital into the social sector. Now, it's no surprise that there's excitement about that at a time when everything that's going on is basically choking off capital and revenue from all of the traditional sources. Every provider is very, very excited about the fact that there's new capital coming into, hopefully, from this vehicle. The other side of the coin is coming from private investors. Okay, and there's kind of a natural wariness of bringing private investors into the social sector among providers. Okay, they have a lot of experience dealing with government, a lot of experience dealing with foundations. They're good at government relations and foundation relations. They don't know how to deal with that animal necessarily. They don't know what that capital, what's going to be attached to that capital. And some of those fears are rational. It's good to be wary of private investors. Some of those fears aren't so rational. So I think that's where some of the limitations and the reservations come through. The second piece of kind of the essential calculus is the notion of preventative and early intervention programs. And there's obviously, and it's been talked a lot about here, there's obviously a very large and growing group of service providers who are invested in that and delivering very, very good programs on that side. The other side of the equation, something we talked about last night with a group of folks who got here early, and that there is also a very, very large and very effective and innovative group of providers who deliver back-end care services very, very well. Okay? And the need for back-end care services that are very expensive with an aging population is growing. So there's going to be a natural tension there in terms of finite resources and how you split them and how you deal with the current need for back-end care that is growing and the absolute essential sense and need to focus on prevention and early intervention. Okay? And the last piece of it that's part of the calculus is this whole focus on outputs, and or simply on outcomes, and we've talked about that a lot here. The interesting thing, it's a different focus on outputs in this model, on outcomes in this model. And the focus here is on they're definable, they're mutually agreed in advance, they are measurable, and they can be confirmed externally by an independent assessor. Okay? And they produce recoverable cash savings, those outcomes. And the issue there is that the whole field, the whole sector is moving inexorably towards a focus on outcomes in that fashion. The problem that there is that kind of moderates and limits and creates some reservations about the excitement of that is that there's a broad range of sort of capabilities and involvement in how to use those outcome metrics and use them effectively. And there's folks who are feeling as though they're not quite ready for this, and will they be left out? And who is going to be there, and how are we going to build the capacity to operate in this model if we're not already there? How is that going to happen? And so the last piece of this, and I'll kind of close it, is the other thing that generates excitement among the providers is this whole new dynamic of a relationship with two other parties where they have a very different standing than they've had before. And now there is a private investor, there's the government, and there's the provider. And the provider in there has a very different sort of a role, because when you button up the whole process of the contracts involved for a pay-for-success model, and it's all ready to go, there's only one thing that matters going forward from there. It's whether or not the service the provider delivers. So all of the performance risk is on that organization. I think that's something that kind of has not yet dawned on the providers in terms of their role and the power they have in the negotiations when you put together those transactions, okay? And I know there's some providers out there, so be thinking about that piece of it. But I think that's kind of what's capturing the imagination, and those are some of the issues that I think are on people's minds in the provider community. And they worry, I think, above all else is, will there be equity in the access to this vehicle? And we can address that in further questions.
You made the simplifying assumption that the money is going to come from private investors, but everything we've heard today suggests that it's going to come from philanthropy. How are providers going to feel about that? Are they going to see this as taking money that they had a pretty decent access to and channel it into a different avenue and cut off their access?
That's not the first time that question was asked. And I know Kippy...
I feel like I've got to be the devil's advocate.
No, well, you worry about the cannibalization aspect of things there, potentially is what that boils down to. I know Kippy and others have been very good about assuring people that that is not going to be the case on this. And I think we have to, trust that, the foundations as private investors, and indeed they are in this case, are looking to utilize these pilots for the pay-for-success bonds, things of that sort, as vehicles to broader systemic change that makes their jobs that much more effective and easier. And what I mean by that is even if organizations don't ever get involved in a pay-for-success financing, but they move down the path of really focusing on outcomes as a way that drives their business. The way in which Kippy and others are going to be making their grants is going to be more effective, is going to generate more positive outcomes than it has previously. So I don't think that's going to be an issue that's really going to be major as we go forward. It's a concern, but I think it's going to be very readily addressed.
Okay. Bill, I want to come back to you. A lot of the discussion has been about the state and local level. It seems as if the federal government is saying, here's a great idea, but we're not going to do anything for it. We want you to step forward. Is there a federal role in all of this, and what is that federal role?
I think there's a very important federal role here because some of the most, I think, promising areas for applying this approach are places where state and local governments make preventive investments. They do spending that ends up reducing federal costs. But in the current environment, they don't actually make those investments because they have no way to capture the savings that they produce for the federal budget. And so the question is there some way to have the federal government partner with the state and local governments in order to break down these budget silos? You know, think, for example, of state and local spending on early education that reduces federal special ed spending, or state and local spending on workforce development that ends up reducing SSI costs. You'd like to have there be a partnership between the different levels of government to capture these benefits, and I think this vehicle can allow that to happen. The challenge right now is what we really is, and so I think as the people said on the earlier panel, we don't actually need new federal money to do any of this. We have sort of enough existing federal money, but what is needed is some appropriations language to give the federal government the flexibility to allow it to take some money that's appropriated for this fiscal year and set it aside and promise it as a performance-related payment 4 years from now, 5 years from now, when the performance objectives are met. And so, I think there's some movement in this direction that can happen under existing authorities, but with a limited change in appropriations language, I think it would be we could see a lot more of this happen. And I think there really are these very large federal spending programs where the preventive investments that would allow some of the spending to shrink are being made at a different level of government.
George, do you want to come in on this, and Tracy? Federal role versus state and local role, and how we balance out the responsibilities?
I think it's very helpful to make a couple distinctions and maybe to use language very carefully when we talk about this. The private side here is a source of financing. I like to use the word financing as opposed to funding, and in the sense that it's bridging a time period. They'll put the money up front, the program gets done, and then if the program works, the government pays them back. And so if you look over the arc of time, the private side isn't paying for anything except for the downside risk of failure. So the role of the financing, which is coming from the private side, is to have a construct which brings a contractual requirement that performance be measured in a very rigorous way, and then it makes sure there are parties at the table there who are going to stay very focused on that. But they really aren't ultimately the source of funding, nor ultimately are they going to be the source of scaling. Another very useful distinction for me is to just think about the magnitudes for a second. Let's take the entire Gates Foundation, not just what they pay out every year, but the corpus. I think it's at $85 billion. If we took the entire Gates Foundation, what is it?
I don't think it's 85.
65? That's changed.
Exactly
Something
Mark,
along
it's
those
not
lines.
I think it's more like 30.
Okay, it's down to 30. Yeah, things are not what they used to be. Proves my point, though. If you took the entire Gates Foundation and directed it towards K through 12, and you blew it all at once, the corpus, I'm saying, you could only pay for a small number of days before the money ran out, compared to the budget of all K through 12, and that's just one of many local plus state plus federal spending areas. So we need, this whole construct doesn't make sense unless it is an impetus for the reallocation of government monies. So there's an incredibly vital role to be played by the private side, but ultimately the magnitude of dollars for this to address the size of problems that we're talking about, I think have to be public dollars. Now, to me, the simultaneously terrible news but good news is that when we do look at social spending, particularly in preventative areas from our government, and we do random controlled trials, it's actually shocking what a low success rate there is. We have a system which I wouldn't call it fund what works, I would call it fund what once worked. And maybe 30 years ago, there was a great program that looked great, and then a law was built. But here we are 30 years later, funding people who say that they do something similar to that program that had good results 30 years ago. And when you go out and you study the hundreds of millions of dollars worth of random control testing that's been done throughout the hundreds of billions of dollars of social spending in this country, that's just at the federal level, you find 9 times out of 10 that it's very difficult to discern a difference between people who were randomly in the program versus randomly not in the program with respect to their life trajectory. I mean, it's an extremely sobering exercise to go through and look closely at the report card that comes from random controlled trials. So it's devastating. But the good news is that 10% of them actually do produce returns, both social returns and fiscal returns. And what that says to me is that as a country, we have this marvelous opportunity. It's a little bit like Dorothy at the end of The Wizard of Oz when you said, Dorothy, you could do it the whole time. Just click your heels together. There's no place like home. 90% of the money is already there. It just needs, this is not about new money coming in. What we now have is a mechanism that can help us to reallocate government dollars. And then what Jeff was saying is that in many cases, those government dollars are going to be in a different silo. So for example, we heard earlier today, housing of homeless can save money in Medicaid. And I would say, from what I've seen, having knocked on a lot of doors now, is that the data is there, and that the next step has to do with the legalities of sharing data. Intergovernmental sharing arrangements and dealing with the privacy issues. But there's a quiet revolution. I mean, the databases that exist are staggering compared to where they were 5, 10 years ago. But they're not being connected. And until we get them connected in a way that's robust enough for contracts to be built, this idea won't go forward. But once we do, I think there's just an avalanche of opportunity that's available.
I wanted to turn now. Do you want to comment on the federal role question?
No, I think enough has been said. So just in the interest of time.
So I wanted to turn now to, I think George let the cat out of the bag a little bit just now by telling us that only 10% of the random control trials, if I heard that right, demonstrate success, which means there is huge risk in this whole arena. And I wanted just to talk a bit about the risk, you know, where does the risk go, and who absorbs the risk? Because I think we've all been assuming that there is no risk. We're going to pick winners, they're going to succeed, and everything is just going to be hunky-dory. But if only 10% of the random control trials are demonstrating success, it's a decent likelihood that half of these things that we bet on are not going to work. So who absorbs the risk, and how do we take account of the risk factor that is in here?
I don't want to take up all the time.
Well, let's let Bill and Tracy comment on the risk.
I think a lot has been said about risk transfer, and let's isolate the different kinds of risk that's underlying the social impact bond construct. There is financial risk, which, by the way, lots has been said about the private investors actually bearing all the financial risk. This is actually of no financial risk to government, which parenthetically is interesting in the wake of the financial crisis, that all the risk in this case has been privatized and the gains are being shared very broadly. So the private investors are taking on all the financial risk. There's also political risk embedded in that financial risk. I think earlier this morning somebody talked about how in this 5 to 10 year arrangement can we give the assurance to the investors that the next administration is going to honor this obligation and repay their principal plus a rate of return. So there's political risk. And I think where Lester is driving toward around George's comments around randomized control trials is going at the model risk and execution risk by the providers. It is true that very few programs have gone through successful RCTs, and if I were a private investor and I'm jumping into this situation, I am only going to invest in areas where there is a proven innovation. In fact, social impact bonds wouldn't be possible were it not for the proven innovations actually with some of the people in the room. I think there's someone in the room from the world of supportive housing. We wouldn't be in a position to think about scaling up supportive housing to address homelessness, and if we could even be so audacious to even think about ending homelessness by scaling what the third-party capital from the private markets to scale up supportive housing, right? Bill mentioned earlier about the perspective of the nonprofit. Historically, nonprofits have two sources of capital: private philanthropy and government contracts. Now, the successful nonprofits have a third source of capital now, which is for-profit mainstream investment capital to tap through this arrangement to scale their great work. And I think it would be risky in this first phase of social impact bonds to get into areas where it's completely unproven and experimental. And that is where the role of philanthropy is. Philanthropy can incubate and provide seed funding for programs to be developed and tested and refined and improved over time so that these programs could now be ready to be scaled through a social impact bond construct. And then the final set of risks that we're asking the investors to take upon is execution risk. Just because a provider has demonstrated excellence in the past at running a $50 million budget and program doesn't mean that they'll be equally effective at doubling the size of the population that they're serving, doubling the team that they are overseeing. And it's managing the execution risk that is embedded over the lifetime of the social impact bond instrument through a very active project management function that's critical to ensure its success. So I think those four primary bucket of risks are what we're trying to ask the private investors to take on. And while these investors are socially motivated, they're also rational investors. They need to be unambiguous up front, and the contracts need to be very meticulously articulated, and the returns need to be fair and robust, and the process needs to be highly transparent. If we can do all those things well, I think the instrument shows a lot of promise, but clearly a very elegant theory still to be proven, because Peterborough is only 13 months in.
Bill, do you want to comment on this, and particularly about the structure of the contracts so that they achieve the right balance between the amount of risk that the investor is absorbing and the return to the investor?
Yeah,
and the same for the service provider. How do we protect the service provider from absorbing more than a fair share of the risk?
And you know, I think we need to be careful here that we understand the perspective through which a lot of the conversation is being filtered. Social impact bonds are one way of doing pay-for-success financing. Okay? There are other ways of doing it and other variations that involve different allocations of financial risk and other kinds of risk. In the room are folks from Minnesota who have a different model of how to do pay for success, where the risk is shifted from government to the providers to achieve other kinds of objectives. And I think the lesson there is that the fact pattern from location to location will drive some structural variations in how risk is shared. That's one piece of it. And we saw, you know, in the UK, that structure of that Peterborough deal was designed very, very specifically to hit that fact pattern that drove the needs in that location. In Minnesota, it's different. In Australia, it's different still, because they have a very small number of nonprofits, but they as providers, but they tend to be very, very large. So there is no intermediary on the financial side. The nonprofits are going to do that. They also have a different sort of a philanthropic community, so they don't have a lot to draw from for folks who are willing to take the non-payment risk. So there's going to be a defined portion of the return that is going to be, in essence, guaranteed by the government, with a portion of it being dealt with on a true pay-for-success basis. And so the answer to this is that there will be variations over time. We can't even predict what they're going to be. There will be a more nuanced allocation of both risk and return among the parties to these transactions. It'll be contractual, whether or not it's in a true contract that's negotiated or contract through a thing called the bond resolution, like would be done in Minnesota. The other piece of this to understand is that the lens through which we're talking a lot about this is through the lens of doing pilots. Okay? And when you do a pilot, you have to have a very unnoisy, unambiguous, unmessy result to prove concept. And that's why we're focusing on a lot of the kinds of issues and structures where it's very, very clean. You can get a really good result. As time goes on and this concept gets proved, you will see that it will be able to do transactions like they're looking at in Australia, where a portion of it, you can identify cashable savings from the positive outcomes in their entirety, but you can in part, and so you are getting outcomes. You will pay for the ones in a pay-for-success model that you can, and the others will be paid for in traditional sorts of means. So I think there's a lot to be seen beyond the pilots, and a lot of understanding here that there's a lot of nuance to come here that will bring a broader group of issues and a broader group of providers and locations into this circle.
We have 3 minutes, if my watch is correct. So I think I'm going to jump to about the state and local role and ask Jeff if he would comment on this. What's going to propel states to get into this? They've got a lot of things on their plate. This is a new development. What do they have to have together in order to do this? And is it enough? Does this have enough incentive to it to cause them to put that kind of investment into learning how to do this?
I think we heard on the previous panel from Linda and from Jay that we really don't have a choice. We have to find some way to get better results for the money we're spending. And there are a lot of different tools one can use, but this seems to be one that's particularly promising and really has a chance of, I mean, there's just so many areas of the budget where we've been literally just funding the same providers that we funded last year, but 1% more or level fund it. We have no idea what results we're getting. And we have to find an approach that allows us to spend this money in a way that we know what we're getting for it, and more than just knowing what we're getting for it, actually improve what we're getting for it. And I think that imperative is so strong that people are going to want to try this. And I think we'll see 3, 4, 5 places try it in the next 2 or 3 years, and if it's successful, then we'll see this take off. And if it, I mean, this is an experiment, and Tracy just made this point. This is an experiment about whether we can deliver a particular service well, but about whether this whole mechanism for financing can work. And if things go well, we'll get 10 tests of this experiment in the next few years, and 7 of them will succeed and 3 will fail, and we'll be able to make a judgment about whether this should scale as a technique rather than thinking about scaling interventions.
Well, I think we're out of time. I think this may, if it all works the way you're all designing and thinking, we're going to violate one of the central rules of government, which is you get ready, shoot, and then aim. And it would be wonderful if we reverse some of that order. So thank you for helping us understand what's required, and thank all of you for your attention.